Imagine being in a position where the only thing that could save your life is unavailable because we're in a national shortage of it. Now that we are aware of the national shortage of blood products in the United States, it's time to take action. Let's dive into the first steps of becoming a donor, where every donation is potentially a life-saving gift. Ensuring eligibility for blood donation is a crucial step in safeguarding both donors as well as recipients. Donors normally need to be at least 17 years of age, weigh 110 pounds, and have overall good health. Other factors could affect eligibility. Recent surgeries, specific medical conditions, and medication could temporarily disqualify someone. Some behaviors will permanently disqualify someone from donating, high-risk behaviors as well as some diseases. It's very important to be honest in the screening process. Being honest during the eligibility process helps with the upholding of the integrity of the blood supply chain. Signing up for a donation typically involves filling out paperwork and providing essential details to ensure safety of the donor recipient. Once the donor arrives at the donation center, there are registration forms that are needed to be completed, usually with general information, name, address, telephone, date of birth, and emergency contacts. The donor will also need to provide a valid ID to prove who they are. During the screening process, the donors are asked a standard set of questions. The answers from the donors will determine if they are able to move forward with the donation process. If the donor is eligible to donate, the donated blood is tested for blood types ABO group and Rh type, positive or negative. This makes sure the patients receive blood that matches their blood type. Centers for Disease Control and Prevention, July 2023. Transfusion-associated sepsis causes are encountered occasionally, and bacterially transmission remains the major cause. Patel, TG. Impact of donor arm cleaning with different antiseptic solutions for prevention of contamination in blood bags, pages 17 through 20. Sterilization and preparation of the donation site for the blood donation is a very crucial step in the process. Before donation begins, the site is thoroughly cleaned and sanitized using a medical-grade disinfectant to help with the minimizing of the risk of infection. Not only is the site disinfected, but surrounding areas as well are also wiped down. Surfaces, armrests, and donation beds are all sanitized. Blood transfusions is considered a life-saving therapy since ancient times, but at the same time a high-risk procedure. De Silvestro Gustina, Transfusion, Medicine, and Patient Safety. The donor will be sat in a chair. The donor's arm will then be cleaned. A tourniquet will be placed around the arm to make the vein more visible. A sterile needle is inserted, and once the blood begins to flow, it will be collected in a sterile bag. The time frame for a donation depends. It could be from 10 to 15 minutes to as long as an hour and 15 minutes. At the desired amount of blood has been collected, the needle is removed, discarded, and a pressure bandage is applied to the donor's arm and should be kept on for a couple of hours. Rest and recovery is essential after a blood donation. At this time, the donors are encouraged to rehydrate with plenty of fluids and by eating the snacks that are provided by the donation center. Once the donor leaves, it is encouraged to add iron-rich foods to their diet for the first day or so. The donation center also recommends no strenuous activities for the rest of the day. Normally, blood donations are generally safe, but there are a few donors that could affect differently. Some of the more common side effects that the donors encounter are dizziness, lightheadedness, or fainting, which may be due to a BP drop. Additionally, there are rare and more serious side effects such as allergic reaction to the anticoagulant that is used during the donation. It is essential for donors to be aware of these potential side effects and to report any unusual symptoms to the donation staff promptly. A single blood donation holds the potential to save numerous lives and significantly improve the health and well-being of individuals in need. After the donation, the blood is separated into 4 different categories: red blood cells, platelets, plasma, and medical purposes. The impact of single blood donation resonates across communities, profoundly affecting the lives of patients, families, and healthcare providers alike, underscoring invaluable differences that each donor contributes to the world. Blood donors are often unrecognizable heroes whose articulate contributions not only save lives but also instill hope in countless individuals facing adversity. Their actions go beyond simple acts of kindness. They exemplify a sense of empathy and unity that strengthens communities. Each donation that provides a vital lifeline for patients undergoing surgery, fighting cancer, or recovering from traumatic incidents. In appreciation of their noble gestures, blood donors frequently receive tokens of gratitude such as certificates, pins, badges, acknowledging their selflessness and encouraging continued support. In conclusion, donating blood is not merely an act of kindness, it is a profound expression of humanity and compassion. By giving just a small portion of ourselves, we have the power to make a monumental difference in the lives of others, whether it's providing vital support to those undergoing medical treatments, aiding emergencies, or ensuring a steady supply for those in need. Our contributions are invaluable. Let's continue to answer the call to donate blood, knowing that each donation has the potential to save lives and bring hope to those facing adversity. Together, we can make a lasting and life-saving impact in our communities and beyond. Thank you for considering the gift of life through blood donation.